Welcome to today's lesson with Caleb Mlonga. We are looking at asthma, specifically clinical manifestations, also known as the signs and symptoms. Without wasting much of our time, if you have not checked out the video for the signs and symptoms, just check the link will be in the comment section. So the first sign and symptom that we have is wheezing respirations. Okay, so wheezing sounds, basically these are sounds that occur, which are whistling sounds that may be made during expiration, meaning breathing out. And these wheezing sounds are due to the airway being blocked or compressed. So wheezing sounds are due to airway blockage or compression. Okay, that's the first one. The second one is expiration is forced and prolonged due to bronchospasms. Expirations, meaning breathing out, is forced and prolonged due to bronchospasms. So because of because of the compression of the broncho walls, okay, because they are compressed, because the lumen is being reduced, okay, what is happening here is that the airway is being reduced or compressed, and because of that compression, that is what we call bronchospasms. And because it is being compressed, you find that someone will have difficulties to breathe out because that air has to be forced, therefore it will be prolonged. So this is due to bronchospasms, hyperinflated lungs, and trapped alveoli air. Number 3, we have dry cough or cough which may produce thick, clear, or yellow sputum. So basically, we just say dry cough or productive cough, and this is due to hypersecretion in the airway. That is for productive cough. So that is due to excessive or hypersecretion of mucus in the airway. Number 4, we have chest tightness due to bronchial constriction. So because of the bronchi, because of the airway being constricted, the person will feel some form of chest tightness. And when we say chest tightness, we mean the person's chest they feel as if something is compressing their chest. The chest feels compressed or tight. Okay. Of course, we also have anxiety, which is due to difficulties in breathing or breathlessness. So you find that someone who's not breathing, if you are not breathing properly, you are going to be anxious. So that is just. Then we also have sweating, which is also called diaphoresis, which is due to the labored breathing. So because someone is breathing as much as possible, they're trying to breathe as much as possible, but they're struggling to breathe. So you find that they start sweating. Then we also have dyspnea. We also have dyspnea due to thick mucus in the airway. We also have mucosa edema or smooth muscle spasms. So all these are going to cause a obstruction in the airway, which is resulting to edema. So edema due to thick mucus in the airway, which is blocking the airway. Okay, and then we also have orthopnea. Orthopnea is a type of edema, a type of dyspnea rather, where someone fails or has difficulties to maintain or breathe while they are lying flat. It can only be relieved when they are sitting upright or standing upright. So this orthopnea, again, is due to blockage in the airway. It is due to blockage in the airway. We also have cyanosis, which is due to reduced or low oxygen in the blood. Cyanosis due to low oxygen in the blood. Also have hypoxia due to low or reduced oxygen in the circulation of the blood. Of course, we also have other signs and symptoms such as fatigue due to poor blood perfusion, okay, oxygen perfusion rather, okay, due to the poor tissue perfusion, meaning oxygen has to go into the tissues, but because of low oxygen, you find that the person will be fatigued. They will not have enough oxygen to produce energy. We also have headache due to cerebral hypoxia. Okay, so all these are signs and symptoms, and we also have tachycardia. Tachycardia due to an attempt to compensate for hypoxia and hypercapnia. Okay, so basically what we're saying is that there will be tachycardia, meaning an increased heart rate, and this is coming as a result of the heart trying to compensate for the low oxygen in the blood and the increased carbon dioxide in the blood. So that is that about our condition. So if you have any questions, we can ask so that we can answer them in the comment section. Again, thank you for watching. You are most treasured. See you in the next video. Thank you for watching. God bless.